Welcome to the Explainer. Today, we are diving into a neurological puzzle that actually reveals a critical design flaw in our own brains. A single point of failure where this incredible efficiency comes at a terrifying cost.
So let's start with a mystery that neurologists solve every single day. You have a patient who suddenly experiences total paralysis on one side of their body. But, and this is the really weird part, they're completely alert. They can speak, they can understand everything, no confusion at all. The damage is obviously catastrophic, but it's also incredibly specific. So how on earth can a tiny lesion, maybe the size of a pea, cause such a complete yet clean shutdown?
Okay, so let's really break down this case. What are the specific clues here that are going to point a neurologist in exactly one direction and at the same time rule out everything else?
This very specific pattern, well, it has a name. Doctors call it a pure motor stroke. It's just a total loss of the movement commands to the face, the arm, and the leg on one side. But you don't get any of the other things you might expect from a big stroke, like problems with language or seizures. So the question becomes one of anatomy. Where, in this incredibly complex brain, could one tiny point of failure take out the entire motor system for one half of the body and absolutely nothing else?
To find that single point of failure, we have to look past the thinking parts of the brain and really get into its wiring. We're on the hunt for a superhighway, a place where all the critical traffic is forced to merge together. And here it is. It's called the internal capsule. And as you can kind of see, it's a V-shaped bundle of what we call white matter. Now, you can think of white matter as the brain's insulated cabling, all the wiring that transmits signals at incredibly high speeds. This isn't where decisions get made. No, this is the express lane where all the messages have to travel.
This analogy just perfectly illustrates the problem. Right? If the cerebral cortex, the big thinking part of our brain, is like a huge country with all these different cities and towns, well, the internal capsule is the one single bridge that connects it all to the rest of the world. It is an unbelievable design for efficiency, but it's also a massive single point of failure.
Okay, now let's get way more specific. Not all information is traveling in the same direction or even on the same path. By tracing these individual neural pathways, we can start to see how neurologists literally use the brain's own wiring diagram to pinpoint the exact location of a problem.
So the traffic on this super highway, it's a two-way street. You've got these descending motor commands going out to the body, and then you have ascending sensory information coming in from the body. And this is absolutely crucial for our story. Almost all of these major pathways are cross-wired. That means your left brain controls your right body, and your right brain controls your left body.
Okay, let's trace the main motor superhighway. It's called the Corticospinal tract. So a command to move your right hand, it starts in your left motor cortex. It travels down, funnels through that internal capsule, and keeps going down the brainstem. And only then does it cross over to the right side, deep down in the medulla, before it heads down the spinal cord. Now remember that crossing point, the medulla.
Now let's trace a sensory pathway, the one called the dorsal columns. These carry signals for things like vibration and proprioception, which is just your brain's subconscious sense of where your body parts are in space. So notice this, a signal from your right foot travels all the way up the right side of the spinal cord, and what do you know? It also crosses over in the medulla, at basically the same level as the motor pathway.
But here is the critical difference. This is the kind of detail that neurologists use to solve these cases. The spinothalamic tract, which is the one that carries pain and temperature signals, it crosses over to the opposite side almost as soon as it enters the spinal cord. So that means for almost its entire journey up to the brain, it's already on the opposite side from where it started. This staggered crossing is like a master key for diagnosis. So all the evidence is pointing to a problem with that main motor highway, a total signal failure. But to be really sure, we have to contrast this with a totally different kind of movement problem, one that comes from a different part of the brain entirely, the cerebellum. See, a problem in the cerebellum doesn't cause paralysis, not at all. It causes a condition called ataxia. With ataxia, the signals are still getting through, but they're clumsy, they're uncoordinated, and jerky. It's an issue of control and fine-tuning, not a complete signal blackout like we're seeing. And this is just a perfect example of what we call neurological localization. The cerebellum's job isn't to send the first command. Its job is to ensure coordination and precision. You can think of it as the brain's quality control system, just smoothing out all our movements. So damage here causes ataxia, that clumsiness and inaccuracy, not the complete paralysis we see in our patient. This tells us the problem isn't with the fine-tuning, it's with the main signal itself.
Okay, so we've mapped out the highways and we've ruled out other locations. Now let's get to the traffic jam itself. What could possibly create such a sudden, precise roadblock deep inside the brain?
Well, the culprit in our mystery is very often something called a lacunar infarct. The word lacuna literally means empty space or gap, and that's basically what this is. A tiny little stroke, less than 15 millimeters across, that's caused by a blockage in one of the tiny little arteries that feeds the deep structures of the brain, exactly where our internal capsule is sitting.
So how does this happen? Well, over time, chronic conditions like high blood pressure or diabetes can actually damage the walls of these tiny arteries. The process is called lipohyalinosis, and you can think of it like rust building up in a pipe. It causes the walls of the vessel to get thick and hard until one day they just close off completely. And that creates our tiny, pea-sized stroke and a sudden total roadblock on that neural superhighway.
All right, so we have a likely location and a likely cause, but to be absolutely certain, we have to do one last check. We need to compare the symptoms from our internal capsule lesion with a stroke that happens on the brain's surface, the cortex, to really see why they're so different. And this table right here, this is the whole diagnostic key. Just look at the differences. A lesion in the internal capsule causes a dense weakness, affecting the face, arm, and leg pretty much equally because all those fibers are packed together so tightly. A cortical stroke, though, it's usually more partial, maybe affecting the arm way more than the leg. But most importantly, a capsule lesion has no aphasia, no seizures, no neglect, because it's only hitting the white matter wiring, and it's sparing all of those specialized cortical areas. You know, the absence of seizures is a massive clue. Seizures are caused by these abnormal electrical storms in the gray matter, the brain's processing centers. But the white matter of the internal capsule, it's just wiring. It doesn't generate seizures. So no seizures points us away from the brain's surface and deep, deep into its core. And there it is! The case is solved. By following the clues, the specific pattern of weakness, the absence of seizures, we've managed to pinpoint the lesion's exact address. In this solution, it reveals something really profound about the architecture of our own minds.
Here's the reveal. The reason a pea-sized lesion can be so completely and utterly catastrophic is all about its location. It's not about the size of the damage, it is all about its address. It hits that one critical bottleneck, where all the motor commands for one half of the body converge into a single compact bundle. It's a design that is incredibly efficient, for sure, but also incredibly, incredibly fragile.
So this whole clinical mystery teaches us a pretty crucial lesson about our own biology. The brain's design really is a marvel of efficiency, packing a superhighway of information into a tiny space. But that elegance comes with a terrible fragility. And it leaves us with one final question to think about. Where else in our own bodies is there a design so efficient that it's just one tiny flaw away from total disaster?